I'm going to make a bold claim. We have the secret to supercharging the impact of every single global health and development program. In fact, there is evidence, published evidence, that says we can improve vaccine uptake rates by 14%. We could prevent 1 million cases of HIV. We could give somebody an additional 8 years of expected life. Prevent 14 million cases of tuberculosis. We are going to improve school attendance, employment outcomes, the list goes on and on and on. In fact, this is so good that the WHO says that for every dollar invested, you get a 4x return on investments. Just think about that. That means you can quadruple your impact. What am I talking about? I'm talking about integrating mental health. My name is Joy Bittner, and I am the co-founder and CEO of Vida Plena, a nonprofit organization based in Quito, Ecuador. And what we do is we partner with local organizations, regional governments to be able to integrate mental health into their existing services. What we do is help them supercharge their results. So why do we do this? The impacts of poor mental health affect every single area of life. It traps people in a cycle of poverty. It affects every single type of global development program that's out there. Just think about it. If you're depressed, are you going to properly set up your bed net? Are you going to attend the prenatal appointment? Probably not. If you yourself or someone you love has been depressed, you know what I'm talking about. This is more than just sadness. Depression and poor mental health is something that affects every single aspect of life. It affects your relationships, your family, your education, your jobs. It's a sense of hopelessness that even leads some people to consider suicide. The good news is, though, that we have results that work. We're not just talking about fuzzy ideas and feel-good projects, but really these are evidence-based treatment programs. They're scalable, proven, and cost-effective. One of these is group interpersonal therapy, which is the WHO's top recommendation for treating depression. It has over 20 years of empirical RCTs and studies that have been conducted globally. I want to call your attention to the study that's at the bottom. And as we know, most studies conclude with more research needed. However, this study stands out to me because it concludes, and I want to read this for you, that it says, there is no doubt that IPT efficaciously treats depression. IPT deserves its place in treatment guidelines as one of the most empirically validated treatments for depression. And this holds up within Vida Plena as well. Over the past 12 years, we have treated 1,200 people. And I want to emphasize that we've treated, not just enrolled, but treated 1,200 people. And of them, 71% have ended our program with mild to no depression symptoms. And in case you're thinking, well, maybe they just would have gotten better on their own, this just kind of naturally happens. On average, our participants see 7-point improvement on the PHQ-9, which is the standardized scale for measuring depression, which is what experts consider to be above and beyond the expected rate of spontaneous remission. So not only is our model based on rigorous evidence, we don't stop there. In fact, we've partnered with Columbia University for all of our PT trainings. Columbia University is the original creator of the WHO manual, and we are on track to be the first organization that is certified as trainers, meaning that we can then provide this training to other organizations who are interested in implementing. So how does it work? Small groups of people, about 8, get together in churches, local community centers, and they meet once a week over the course of 8 weeks, where they learn about how to improve their relationships, how to improve their communication, make better decisions, really be able to understand the bi-directional relationship of how their depression affects their relationships and how their relationships affect their depression, ultimately helping them to better manage their depression. So one of the things that really makes us stand out is that we combined world-class expertise with local knowledge. I myself have been living in Ecuador for over 13 years. My co-founder, Anita Caslin, is an Ecuadorian clinical psychologist. And what we do is we train local community members, non-specialists, to be able to facilitate the groups. These are people who are from the communities, fully understand the needs and challenges that the people in their groups are facing. Our organization is 100% locally based. So a quick recap. Depression prevents people from moving forward, and we have evidence-based programs that make a difference. However, development organizations and local government programs aren't taking advantage of these. So this is the gap, and we do know how to close it. And that's where Vida Plena comes in. We are working on implementing group interpersonal therapy across Ecuador with ambitions to scale throughout Latin America. And this is what we've achieved so far. We are supporting a 3-year program funded through USAID to provide mental health care and entrepreneurship training to vulnerable women entrepreneurs. We have piloted with the city of Quito to train their outreach workers. And we've partnered with over 45 nonprofit organizations throughout Ecuador. Our goal, and we're building for the future, our goal for next year is to be able to treat 2,700 people and laying the groundwork to be able to partner with the Ministry of Health, ultimately scaling across all of Ecuador. So let's face it, mental health at this point, we know isn't just a nice to have when you're talking about development programs. It's critical. It amplifies everything else. And so Vida Plena is leading the way in Latin America, but we need more voices in this movement. So if you're a researcher, an economist, or funder looking to supercharge your work in global development, we'd love to partner with you. We'd love to come together with you to be able to implement mental health programming across a range of global development programs. Let's demonstrate that it is possible to supercharge the results.